Yes. All right. Welcome to this afternoon session, COVID-19 Impacts to Child, Youth, and Family Wellness. We have some slides to share, but first I want to introduce our panel members. I'm Lieutenant Colonel Bonnie Jordan. I'm the Program Director of the Developmental Pediatrics Fellowship Program at MADIGAN. And with us today we have Colonel Eric Flake, Developmental Behavioral Pediatrician, as well as the Developmental Behavioral Pediatrics Air Force Consultant to the Surgeon General. And then I have Lieutenant Colonel Jean Burr, who's the Chief of our Adolescent Medicine Department here at MADIGAN. And I have Captain Matthew Scott, who is one of our Developmental Behavioral Fellows. And our goal today is to provide you with some basic information from our professional realms and our experiences as pediatricians and specialists in COVID and how it affects wellness for children and families, and some tools for your toolbox. And then just be here as a panel to answer some questions that you might have either as a family member, as a friend, or as a command team, so that you can have good information as to how to best support your soldiers and their families. We have no disclosures today to report. So first, let's just talk about, set the stage. What are some challenges right now for parents and children? During COVID, we could probably think of many, many more challenges than what we have up on the screen there. But these are the main things that we've identified that we see in our patient population or even in our own families when we look at the challenges COVID has brought for families. Loss of childcare and supervision, loss of social experiences, stress, change. Many families are experiencing financial stressors due to either loss of job or changes in jobs, or due to changes in how their childcare and supervision is occurring, and then having to pay for that when they weren't previously paying for that. Loss of services and supports, and then limitations in everyday life, limitations in activity and recreation. And then we look at some unique aspects on top of those challenges unique for military children. For a lot of military families, they're geographically isolated from their family. And so extended family, grandparents, aunts, uncles, cousins might live very far away. The active duty parent might be geographically in a different location than the family and the child. And so things like family care plan or extended family support are a lot more difficult to access during this stressful time. And then depending on where the military family is in that PCS cycle, their COVID experience is very different. If you were at the beginning of a PCS when COVID started and the lockdown started, you may never have had your chance to identify or build your social network, understand your educational resources. Maybe you moved at a time where your child never entered a school building, and so they weren't able to connect and make friends. That building of community, understanding the whole family dynamic after a new PCS, and all of the challenges that may come along with reestablishing healthcare are unique challenges for military children, and also unique to where military children and families are in that PCS cycle. And then, of course, the mission essential status of the active duty parent may create some challenges if the service member is in a unit that has deployed in support of COVID, or another deployment mission, or on frequent TDYs. That, of course, always impacts the family and the family dynamic and the child. And during COVID, when we've had social isolations and quarantines and loss of all these other experiences, that may be more challenging for children. We also know that military children have some unique protective factors that we want to focus on too. So establish patterns of virtual communication during separation. Most military families experienced separation and isolation from someone in their family before COVID. And so many people have been able to say, hey, I'm already really good with using FaceTime or Skype to connect to my family member. Lots of military families are very experienced with distance relationships, and that might be a protective factor during social isolation and COVID. Financial and food security. typically something that we can say is a protective factor in the military because of the unique military resources available to our families. And then, of course, other military unique resources for childcare, healthcare, education, mental health, and then the military community at large. So real quick, we want to go through some of the basics when we think about wellness for a family and wellness for children of all ages during COVID and all the unique challenges that COVID has brought into our lives. First, we want to stay positive, right? And where does staying positive start with? That starts with self-care. So self-care for parents and self-care for children. But for parents especially, take care of yourself so that you are available and ready to take care of your children. And then be honest, but also positive when you can about some of the challenges that are being faced in your family, in the community, and the challenges surrounding COVID. Stay active. Think of unique ways to stay active. Maybe a dance party in your living room if it's really cold or rainy outside. Maybe going for a walk. Whatever you can come up with in your family, but staying active is a very vital role for wellness in general, and especially for children. It helps break up your day. Use it, leverage activity to keep from being sedentary all day, where that can really also impact wellness and mental health. Stay scheduled. And when we talk about staying scheduled, we want you to think about being scheduled with flexibility. So kids are used to schedule. When kids are in school, they have a typical schedule, and that's good and that's helpful for them. And it's helpful for us as parents to keep us organized. But try to build some flexibility into that as well. And that's mostly for your sanity as parents, honestly. Stay connected. We might be socially isolated. We might be under military or government rules on who we can see and how often and in what form, and if we can go to a restaurant with friends or not, but we can still stay connected with our family and friends. And that's very important. Stay informed, especially when we talk about school and education. It's your job as a parent, whether your child is in kindergarten or whether they're a senior in high school. You need to stay informed with what's going on with your child's schedule, their classroom, when their assignments are due and what is expected of them. And that's going to help you feel really good, but it's also going to help you stay connected to your child. And then, of course, we want you to stay safe, right? There's the CDC and the local guidelines for staying safe. They change frequently depending on the pattern of infection in our community, but it's really important during all this that we stay safe as well. So it's a new year, a new school, and a new plan, right? This is already changing for some families depending on what school district they're in. So I know many families that I care for here at Madigan whose children attend virtual school 100% of the time. I know some families who their children attend school face-to-face, but that changes depending on what's going on in the community. Some weeks they're face-to-face, and then all of a sudden, oh my goodness, we're home again. And then I know some families where their children are in a hybrid model. So it's new for everybody. The big take home with this is there is no one size fits all approach. Children learn differently. Families have different needs that they can work with. And so we need to remember for our children that there's no perfect approach. And so while the school might be doing one thing, your child might need some adjustments and might need your support to adjust with that. Remain flexible. And again, it's your job as the parent, stay informed, stay up to date with what your school's plans are doing. And then don't forget, when we focus on school and education, we want to focus on supervision as well. So right now is a time where a lot of families have experienced, loss of school and also loss of childcare. It's really easy to get focused on one or the other, but it's really important that we remain focused on both, because children of all ages need some level of supervision from their parents, some level of childcare, and that depends, of course, on their age and their maturity. And then with that, children of every grade need some level of educational support. So when we think about virtual school, many parents, and I'm sure many of you online joining us today, can talk about some of those challenges that come with it. We are at the end of what we might consider our second semester of virtual schooling for a lot of families. If you think about, we went virtual for many families back in March, and now we've gone through, for many families, a whole semester for this academic year. But some important questions that you want to think about is, what is my child doing? What is their supervision and their accountability plan for education and during the day? And also, what is my child learning? So not just am I keeping them safe, are they logged in, but are they experiencing educational growth? Challenges that we might see for our children are distracting workspaces. Is it noisy? Do you have multiple kids? I've got 3 kids doing virtual school at my house. It can get pretty noisy. We've got to separate them in different rooms and different floors, and sometimes we need to use headphones or other ways to keep them all on track. That, of course, comes with other challenges, because then if one child is upstairs, I'm not as easily accessible to say, hey, do you need some help? But noise is a big factor for our children, and we really need to be mindful of that. Who can your child ask for help? So if your family situation is one where you're at work during the day or you're not there with your child, who can they ask for help? We want to make sure that they have someone available. With virtual school, we have that challenge of loss of peer and adult social interaction. So let's not forget the importance of when our teachers interact with our children at school, or when our coaches interact with our children in extracurricular activities. We want to remember those things and know that that is a challenge right now, that our child is in. We also want to think about there's lots of expected milestones for children. They're not going to prom, they're not going to graduation, they don't have athletics. And while that is just something we have to accept right now, remembering that might be very hard for our children to accept. They have decreased educational time compared to a typical school schedule. And so depending on what the education schedule is for your child, they may experience different educational growth trajectory, and they might need more from us to help bridge that gap. And then, of course, there's technical problems. Some of you might have had technical problems getting on to MS Teams today. I know I needed some help to get everything on myself. And so our children are at risk of experiencing those technical problems in the middle of the day. So again, all sorts of challenges that can come along with this. So there might be hiccups. Don't let it discourage you. Make sure you have that great educational area set up for your child. Think about distractions. Think about the school setting for them, their connectivity, their oversight, their supplies. Do they have everything they need within reach? Do they have a schedule that works for them and for you? If you're teleworking, are you able to arrange your schedule in a way where maybe when your child is on break, the best thing for you is that's when you have your critical meetings. But maybe when your child is on break is when your child needs you the most. And so sitting down and thinking about what is the right way to balance this for my child, and then of course my other responsibilities as an adult. And then
I'm sorry,
schedule some brain breaks.
Mic is not muted. I'm hearing a lot of background noise. Somebody has their mic on.
Okay. So if everyone could go ahead and turn off their mic to minimize that background noise. Thank you for whoever brought that up. We appreciate that. Brain breaks. These are really important. We want to make sure that your child has an opportunity to be a child. Again, whatever age they are, they're going to need a break during the day to be successful with their virtual schooling. Oops. And I'm going to transition to Dr. Scott to talk about children with special healthcare needs.
Awesome. Thanks, Dr. Jordan. So I wanted to, a lot of what Dr. Jordan, of course, talked about applies, but to this special population as well. But when I'm talking about children with special healthcare needs, specifically talking about kids who've been diagnosed with autism, ADHD, learning disabilities, developmental delays, and really many other complex chronic medical conditions. And as talking to the command teams today, it's important for commanders to understand that children with special healthcare needs have been drastically impacted by COVID-19, leading to increased medical care needs, child care limitations, increased cost of care. Children with special healthcare needs and their families before COVID-19 relied on schools, therapists, specialists, nurses, and others to provide medical care, specialized child care, therapy, transportation, and and much more. And COVID-19 took away many of those supports, and the burden then fell on parents. So now parents play many roles. They play the role of therapist, special education teacher, medical assistant, all while trying to juggle everything else with telework and everything else going on. And so it's important for us to remember that active duty service members may need more time to focus on their families and focus on their children who have special healthcare needs. We can go to the next slide. One of the most common challenges that we've seen in children with special healthcare needs during COVID-19 has been behavioral challenges, is kind of a broad term that I like to use. It's increased irritability or clinginess, crying more, just the broad range of challenging behaviors. And children with special healthcare needs are struggling with this more than their typical peers. We saw this especially with the big transition to virtual school, with changes in schedules and routines. And now, as Dr. Jordan mentioned, going back to school in person is another big transition. I, as a parent, think, oh, good, once my kid goes back to school, everything will be back to normal. But for my son, this is normal now. He's been doing virtual school for so long that it's the new normal, and switching back is going to be another challenging and a big transition with new teachers and classmates. And it's important for us to remember that as kids go through big transitions and changes, we're going to see challenging behaviors, regression, and they'll need that extra support. So some of those important things to help kids with special healthcare needs is to ensure that they feel safe and secure, especially as they don't understand what's going on with COVID-19 and everything else that's changing. We can focus on kind of their basic health needs first if we're seeing challenges, sleep, nutrition, but also maybe they're having some constipation or dental pain or other infections. And so taking care of those basic needs first, and then if we're still having more challenges, we can talk about starting or changing medications. And it's also important to have really good communication with their schools. If they have a 504 plan or an IEP, it's important to kind of collaborate with teachers and educators to see, oh, maybe there has been some regression in some areas and we need a few more supports or accommodations in order to give children all the supports that they need. We can go to the next slide. And I wanted to focus in on another subset of kids with special healthcare needs and our children with ADHD. So they've struggled even more so in some ways during COVID-19. If you think about the child who's diagnosed with ADHD, you think of a kid who's bouncing off the walls in the classroom and causing disruptions. But with virtual school, teachers can mute the class. They can turn off videos. They're less disruptive. And children with ADHD during COVID-19 have been misdiagnosed or not diagnosed or not adequately treated with medication. And so they're falling behind without teachers or parents really even knowing. And so it's important for us as parents and educators and leaders to focus on how we can help these kids. About half of children with ADHD have a 504 plan or an IEP. And one study showed that only 59% of those IEPs or 504 plans have been continued during COVID-19. And so there's a lot of missed opportunities for helping and supporting kids with ADHD. Other tips for kids at home who are trying to do virtual school, they need lots of breaks. They need to get that energy out. They need the brain breaks to have shorter times that they need to focus, and then have times for physical play and rewards and motivating activities in between those more challenging and times where they need to focus. Another important part is even adolescents who have ADHD, maybe they were successful in school. They've found ways to accommodate or kind of overcome their own ADHD, but now everything's changed. They don't know how to accommodate, or they don't know how to manage their symptoms in the virtual environment. And so parents need to have a more hands-on approach to helping kids with ADHD, even though if they were successful before COVID-19, that doesn't mean they're going to be successful during virtual learning. It's all about positive reinforcement, positive encouragement. reward charts for younger kids, sticker charts, snacks. Older kids can earn recreation time and other age-appropriate rewards. And so kids with ADHD respond really well to those positive reinforcements and trying to avoid all the negative punishments of removing social interactions or not being able to go outside, finding ways to help kids feel more successful and feel like they're doing a good job in school, so they continue to try hard. So these are just a few little tips that I've seen work for other kids with ADHD and other kids with special healthcare needs. But of course, there's many others, and as a parent, you'll have to know what's best for your child and what's best for their education and learning. I think Dr. Burr is coming up next, right?
Yes, Dr. Burr, you're up.
Are we holding our questions to the end?
Hello. So I'm an adolescent medicine doc, and y'all may not know what that is. That means I actually like tweens and teens and choose professionally to care for them exclusively. Yep, I sure did that. I am quite concerned about what this pandemic is having as an impact on our tweens and teens. Remember, people talk about children not being little adults. Teenagers are not big kids, and they're also not little adults. And this pandemic has pushed so many teens into a supervisory or parental type role at home. Here's a nice example. I may or may not have glommed some patients together to make a scenario, and I don't think I have any identifying information. So I have a young patient who has ADHD. Symptoms are generally inattentive, which means daydreamy, and at school does decently well. But now this young person is at home, 14 years old, and expected to log the kindergarten sibling and monitor the third grade sibling in their virtual meets while mom is going to her work outside of the home and dad is a soldier going to work. The 14-year-old is currently failing epically in school because that child feels like their major responsibility is keep the siblings on track. That 14-year-old really needs more adult supervision and engagement. Since this pandemic started, our base services have been limited for tweens and teens, and that's really difficult. It was kind of a Sisyphean choice. You know, do I take this half or this half? Younger children need more direct supervision, but we can't forget that tweens and teens need it too. So we divide them sort of arbitrarily into groups, but remember that development for each individual child is a spectrum. One 11-year-old may be more equivalent to a 16-year-old in some ways, and like a 9-year-old in other aspects of their life. And treating them like they're a number rather than where they're at gets us into trouble. So for the transitional youth, like this slide shows here, we generally think of them as being 11 to 14, tweens, if you will, and young teens. They have, by and large, moved a little bit more towards hybrid learning, so some ability to see friends and teachers in person. Many of them have been given responsibilities well beyond their capabilities because of everyone being stressed. But developmentally, they should be starting to form friendships outside of the family. Because of what we've been forced to do as a society to isolate, they're being robbed of those opportunities to make silly little mistakes that are easy to catch and redirect, right? They're also probably not getting enough exercise, and they're really not mentally is not quite the word I want. They're not quite developmentally capable of planning so far into the future. So normally in middle school, there's still quite a lot of interaction between the teacher and the students of teaching them how to write in their planner. And you check after each thing, and there's physical reminders for things that most kids in this age group are really not developmentally ready to do online school by themselves. Kind of like sending them to college, right? Can we move on to the next slide, Dr. Jordan? I think you have them, right? When we move into teens and young adults, this is really, in my mind, two groups, but we'll link them together. Solidly teens. This is where we start talking about kids are supposed to developmentally be moving from their parents to their peers as the group they go to first. This is when teens start driving their parents crazy because they do and try things that you don't necessarily agree with. But many of us did and tried when we were teens as well. And just like when we were teens, most teens don't learn well from being told an example. They learn best through experience. And this pandemic has forced us to keep them inside, away from their peers, away from school, and all the developmentally normal things they expected to be doing 2 years ago. Let's take the average 15-and-a-half-year-old. What did most of us look forward to most at 15-and-a-half? Getting our driver's permit. I've had so many families tell me that they haven't been able to negotiate how to do this. So not only does this young person have to learn how to drive, but they have to deal with the uncertainty of when will I get to learn how to drive and how will this work, right? Again, there's a larger supervisory role being used and less time with peers. Many of them may have the same issues with planning and executing academic roles on their own. And most adults would think, oh, you're 16 or 17, you should be able to do this on your own, right? But just like us adults, they have fears that are more sophisticated about, well, is life always going to be different? Am I going to get to have a graduation? Am I going to ever get to have a boyfriend or a girlfriend because I'm not allowed to see anyone? And these are kind of the things that they should be doing. So what has this done to them? What this has done is caused our normally pretty epidemic mental health issues to blossom. And it blossoms in silence. So how do you know what's going on with your child? You've got to check in with them. You've got to ask, how are you doing? Are you worried? Are you anxious? Do you want to talk to somebody? Have you thought about hurting yourself? Do you have any friends who you're worried about hurting themselves? So it's the same stuff we talked about for younger kids and kids with developmental issues, that being engaged, being there, exercise, connectedness. Dr. Jordan's one slide had about families creating pods and some communities moving towards this. We know that the high school students are likely to be the last to go back to in-person schooling. So I've been encouraging families to talk about and embrace the idea of pods. So what is a pod? You identify 2 or 3 friends that your teen is very comfortable and reliant on. You engage with their parents and decide, well, what are our risks? Does anyone have high COVID risks that we wouldn't want to do some gradual socialization? Maybe Sally, Bobby, and Jane come to my house on Monday to do virtual school. And on Tuesday, they go to Sally's house. And I forgot the kids' names I invented here for the example, but rotating houses and having them doing their school near each other. Because remember, in high school, all the teaching isn't from the teachers. It's also from peers. And many have no access to each other outside of the group classroom chats like this, right? Lots of teens mentor, and that's harder to make happen. So I think we can support them better, encouraging them to exercise and interact socially, perhaps encouraging school to support Zoom meetings or whatever the platform, just, a social hour every few school days to allow those kids to interact. And remembering, when you're holding your teens and tweens accountable, when you're taking away their electronic access to their friends and they have no physical access, you're really stressing them highly, right? Our clinic is open and sees lots of teens and helps with lots of these issues. But it's been a rough go. But they are resilient and amazing. Just witnessed the 22-year-old who spoke from the heart with her poetry at the inauguration. that's why I see teens, because even though we may not meet them with what they need, they continue to amaze us. But we have to keep investing in them.
Thanks. This has been such an enriching discussion so far, and really appreciate those that have stayed with us and participated and listened on. And we're looking forward to answering some questions. I want to take the next couple of minutes to focus on kind of what teens are saying about themselves, because often we as adults look towards teens and put our ideas and thoughts onto them. But this is a slide that happened a couple years ago, actually before COVID. It's a national survey asking teens what they saw was their biggest problems amongst their peers. And they identified anxiety and depression, up towards 70% of being a major problem, over bullying and alcohol and pregnancy. So I think this is something for us to pay attention about, and as community advocates and leaders and parents, to really take a thoughtful pause on what is it that we can do to help prevent or mitigate some of the concerns that they're having amongst their own peers, and also empowering teens to be able to help address some of their own anxiety and stress. And as we know, often stress, as it gets at high levels, is called toxic stress, and which leads to higher and higher levels of anxiety. And then that anxiety turns into more of a depression as it wears down our serotonin levels. Next slide, please. So we inquired teens just recently about what some of their concerns are, and then also what some of the parents' concerns are. And this was from just an online survey, and lots of parents are bringing up that they're worried that their son or daughter are demonstrating signs of depression during this time. Their parents are wanting to know what to look for, and what are the tools that they can help them work through when they're showing signs of anxiety based off of a lot of the stressors that are happening in our community, or kids not usually able to utilize activities that often release stress. I really like this part right here of what a student was saying. And so just would read this out loud for those that don't have the slides. I'm feeling very anxious lately. Sometimes I'm sad. This is a student talking, obviously, because I'm not able to go to school and be with my friends. My parents try to help me, but sometimes I still feel sad and lonely. I also see many terrible things going on in the world with COVID, and people get hurt all of the time. And it seems like so many adults are stressed out and worried. This makes me stressed too. All of these changes are hard for a 12-year-old. So I think that really encapsulates a lot of the feelings that maybe our tweens and adolescents, and maybe even younger, are going through. So I want to talk about some things maybe to immunize or help support our teens going through these challenging times. Next slide, please. And as we wait for this slide to come up, it's a mnemonic that is something to help us as advocates to think about how do we provide an immunization as we're all anxiously awaiting to get our COVID vaccine. Well, this is a vaccine or immunization that we can do for anxiety. And just the reason why it's titled Who Me is because really we can all take ownership and recognize what we can do to be able to help advocate to prevent some of the significant symptoms that come from anxious thoughts and feelings that then again can lead to depression and other problems. So the mnemonic starts with W standing for work, H is healthy habits, O is optimism, M is mental strength, and E is endure. And that Who Me, I'd like to illustrate how these different pieces could help out throughout a time where we worry. And there's a concept called a worry wheel. If you go to the next slide, I'll walk us through this a little bit and understand what happens to us as humans, because we are designed to get anxious. And that's why sometimes up towards 70 or 80% of us suffer or experience significant feelings of anxiety. This is a combination of multiple different sources, but one of the primary ones is from this My Anxious Mind, A Teen's Guide to Managing Anxiety and Panics. Like I said, we're designed, and that picture of the brain there is to highlight that our amygdala often takes over, and it hijacks our brain and really starts getting us into a circular, sometimes a spiral wheel of what's identified as the worry wheel of an anxious mind, an anxious body, and anxious actions. And they can start at any one of those that then precipitate feelings of an anxious mind or an anxious body, and what our body does with that. And in the interest of time, I won't spend a whole lot of time, but I think we can all reflect back on when our body gets overly anxious. What does our mind start to do? And what type of actions do we start showing? And so I want you to think about this for yourself, but then also the ability to how we can teach our youth on how to identify, is it their anxious mind or anxious body or anxious actions that are happening. And I'd like to start in the bottom right-hand corner, because the body is such much more of an external thing to look at. And this part of the who me, obviously all of this takes work, but in an anxious body, you have to have healthy habits. And so starting with appropriate sleep and exercise and nutrition. But then from there, there's some specific things that you can do to calm your body. Whether it's breathing. Breathing is the number one intervention that people will bring up in order to help with calming your body. The other one is a progressive muscle, where you tighten a muscle and then you relax it. A lot of it has to do with controlling that muscle and the relaxation that goes with it. And then visualization. Visualization always has to do with kind of envisioning your body being calm and relaxed. And that are ways to help with a calm body. The next one has to do with an anxious mind, which are ways to calm your mind. And this is the mental strength portion. And I recognize that the slides probably got left off, but just in brevity, the way to calm your mind is a lot about anticipating and thinking and planning with your mind, and anticipating that you're going to have stressors, and what type of strategies do you do when stress has come, whether it's breaking them down into smaller pieces. Some of these pieces in here, the ABCD log, the ICANN, the deal, and the negotiation, and the Think Smart checklist are ways of decatastrophizing things that happen to you, so that you don't make a mountain out of a molehill. And some of these, the deal, for example, is describing the problem and then expressing it and then asking for help and then listing possible solutions. And then the last one is looking, and so again, the who me immunization there is the mentally strong, the optimism, the positive thinking. And I know there's been a lot of preponderance of positiveness during this presentation, but I don't think it can be oversold enough. And it's amazing how negativism tries to sell. It tries to take the forefront of our attention, but it's almost takes work to be optimistic. And then finally, as you're having an anxious body and you're using the calm body tools and you're using the calm mind tools for the anxious mind, there's certain things that you can do that actually are calm action tools. And these are ways that you can actually take actions to reduce your anxious actions. And a lot of times anxious actions fall into the realm of a panic attack, and taking the work of jumping back, which if you start catastrophizing and feeling strong about something, you're able to take a step back. Or the other one is the staying afloat when you're riding the wave of panic that you know, and you experience panic, but you know that you're riding on top of it. And then there's things called the fear ladder or facing my fear plan. And a lot of those have to do with asking your questions about, you know, how important is this going to be a day from now, 10 days from now, 5 years from now, 10 years from now, which often leads to the last part of this immunization, which is endure. And so with that, there are some very good tools to help with the worry wheel and minimize anxiety and depression, which we feel is going to be something that's going to be ongoing even after some of the restrictions get removed and kids are going back to school full time, and there's not hesitations about them being able to socialize. But we're concerned as professionals that these things are going to continue to be pervasive, because they were even before COVID started.
Thank you to our panel members. Before we open it up for questions, it's unclear if some of the slides cut out. Are you able to see the resource list that is projecting there on the screen? There is a version of that should be in your virtual swag bag, so those should be available to you. I do want to kind of close our presentation part and open it up to questions, but I want to reinforce some of the key things we went through today. So we talked about how children of all ages, our younger children, through our tweens and teens, and then children who may have some special healthcare needs or academic challenges might be affected differently by the pandemic and what is happening in our community and what is happening in our homes and our educational environment. I do want to kind of put a specific plug out there to our command teams who are listening in, who might be here so that they can better support their soldiers, whether they do or do not have children at home during this time. It's really, really important from our standpoint as professionals that when you're working with your soldiers, you're looking at, of course, your mission and the mission needs, but you're looking at people first, right? And you're looking at each soldier and their individual needs. So we've heard plenty of times from soldiers and from parents, well, you know, my kid is older, so they're allowed to be home alone. So I'm not really getting any support to have an alternate work schedule or telework. And then they're coming to us to talk to us about failing grades or a lot of anxiety and depression, and sadly, maybe some more suicidality than we might have seen before. And in talking to these parents and these soldiers, what we're realizing is it doesn't matter if your child is 14 and is old enough to stay at home alone. There's a huge difference between an older child staying alone at home while the rest of the family goes and has dinner, and that teen just doesn't want to go. So, okay, fine, we'll leave them. Or, hey, my 14-year-old had a little bit of a cold, and so I'm going to keep him out of school for today while I go to work, but they're not so sick, they need a parent. There's a huge difference between that and having a 14-year-old or a 12-year-old or a 17-year-old, you pick the age, it doesn't matter. There's a difference between a little time alone and all day, every day, an entire semester or school year. And so I really charge to the leaders out there to meet with your soldiers, have some individualized plans, talk to your soldiers and your families so that we're not ignoring our older children just because they don't need childcare and they're not in school, because as we've talked about, there are those needs present. And so while we have talked about lots of things we can do in families, I would just urge you to consider those. And I think Dr. Bird has a comment before we open it up for questions.
I'm going to expand that a little bit. the base guidelines that we see that are, a 14-year-old can be home alone for 6 hours have kind of been played out to say a 14-year-old is allowed to be home unsupervised to do school solo and have parents come home at dinner time. Then they may be, making dinner and everything on top of it. My practice and that of my 3 partners absolutely has moved to almost all mental health during this crisis. And it is definitely something that as a community we can approach by supporting those kids more. Even a few hours with a parent during the school week could make a huge difference in the mental health of these kids before we can get them back to school. And Dr. Jordan mentioning suicidality, sometimes I don't have official data, just my gut feeling based on what I do on a daily basis. It's up an enormous amount. It's at least 1 or 2 patients per week between the 4 doctors that exclusively see teenagers from this base that we are dealing with a child that we are eminently concerned that they want to take their own life. This is not, yeah, it would be nice. This is a crisis for these kids. So please support these families as best you can.
Thank you, Dr. Burr. All right, I'm going to open it up for questions. And to do this, I'm going to ask you to use the feature to raise your hand because not everyone has access to the chat box. I see a few hands raised, so we'll go first to Miss Norma Mello.
Thank you. Number one, thank you to all the professionals who have come on today and shouted from the rooftops. And believe me, I'm hearing you loud and clear. But I do have one question. The school behavioral health clinics that we presently or used to have in the schools, with schools going back part-time, and I mean part-time, only 2 days a week, and one name, or depending on where your last name falls, you'll go on a Monday and a Thursday or a Tuesday and a Friday. If the clinics only are there 1 day, we're missing a whole half of a group. That worries me because I get contact all the time from school counselors and school principals saying our military kids are hurting. And so I immediately, adolescent center, call them, they can get them in, they can at least talk to them. I can't guarantee they can get in, but they can at least have a teleconference. Is there any plan to put you back into the schools for these kids? Because our kids are hurting.
Ms. Mello, that's a great question. None of us are really able to provide the plan that would be in place for the school behavioral health. We do work with school behavioral health, the Developmental Pediatrics Fellowship and our division, as well as our adolescent medicine folks, and work very closely with school behavioral health, but they fall under a different line of authority. So I can't speak on their behalf, but I do know that they are also concerned about our youth and very engaged and wanting to be there. So I think it's a great question and definitely one that needs to have greater discussion here on JBLM and with both the school and the partnership that school behavioral health has. So thank you.
I think we share patients, but I'm not sure that the MFLACs are actually based out of the hospital. I think they're through ACS, but we will look into that because that's a very good point.
And I see a hand raised by a guest, Lynn Smith. I'm going to go ahead and unmute you so you can ask your question.
Okay, I just wanted to ask for, so the worry wheel that Colonel Flake presented, which I thought was great, and there were several tools listed, but they didn't elaborate enough. I wondered if you could possibly send out to the families the tools that they could use at home.
That's fantastic. I would be happy to elaborate further on the worry wheel. Also, that reference of My Anxious Mind provides it very well. I think I'd like to add on one other aspect, and that is of perfectionism. I think in this time of uncertainty, a lot of our youth still strive for perfectionism, and that also is something that creates a lot of angst and worry in them. So in addition to adding more tools with the worry wheel, would also like to share something with regards to how to address children who have challenges with perfectionism. Thank you.
Thank you.
Dr. Burr, if I can add one thing that you could access if you have a phone really readily. It's an app called DHA, as Defense Health Agency, virtual, as in not really, VIRTURAL, virtual HOPE, HOPE box. It's an app that has some guided meditation, some games, quotes, a way to journal feelings, that's free to access, and it's put out through military systems. The app itself has a blue background with white trim and a red star.
Thank you, Dr. Burr, and thank you, Dr. Flake. What we'll do is we will get these resources together, and I will make sure that they get added for download for people who attend. And then we have another hand raised by Caitlin Rutherford. I'm going to unmute you so you can ask your question.
Hi, Dr. Jordan, and to all the panel, thank you so much. This is the topic that I was most excited to hear about during the symposium, and I think it's just so important. And as a mom to 5th and 6th grader, we're dealing with it every day. Just a suggestion, as far as the different resources, they're going to reach all of us who registered, but I would like to see if maybe we could collaborate after the panel, because my concern looking forward, it's going to happen in our house, but it's going to happen in houses all over the post, is regarding the PCS season. And I feel like the stresses that are going to come with PCS are there just in a normal year, but I feel that many of these resources, we have a perfectionist at our house, we have people who have a lot of big worries and big fears, and I feel like just with the uncertainty that time brings, that this all would be very relevant outside of COVID even, just to package up and maybe at least to maybe start with maybe our elementary schools on post, but maybe to have some sort of gathering of school people and your team, and maybe just take it one step further.
Yeah, that sounds wonderful. Actually, we've worked a little bit with the division surgeon on trying to get a video out that can be provided to the family readiness groups as well as command teams if there's interest, parents, and then we certainly are eager and available to talk to schools and parents and commanders. Something that we're all very passionate about. So I would love to connect with you afterwards and see how we could contribute and help make that happen.
Okay, I've got a note. I'll follow up with Dr. Liesemer.
Okay, perfect. And are there other questions out there? Our panel is available for about another 7 minutes. And so we're here for you, whether you're a parent, an educator, a leader, we're here to answer your questions. So just raise your hand if you've got one. Otherwise, we will stay on the line and make ourselves available. All right, I'm going to unmute, it looks like QVC Brunson.
Can you hear me? Can you hear me now? All right, I'm here. Hi, thanks. I appreciate all of this. Some of it is very, very concerning, obviously, but from a more selfish standpoint, and hopefully this will apply to other people. Do you have anything, I guess, any more specific tips other than the kind of be there, spend time, and I know as parents, we're all doing the best we can. We're all fed up with the pandemic. Here we are looking at our kids finally maybe getting to go back to school. And I kid you not, just yesterday I dealt with a meltdown, complete, sobbing, incoherent. And I'm like, what is going on? I thought we were getting through it. And, you know, it's the same things. I'll love on you. I'll hug you. I agree with you that it sucks. I tell you we're coming out of it. What else can we do?
That is such a great question. I think one key tool that we could use, and we could use at any age, from our toddlers to our teenagers, and I say this as a mom who has a toddler and several ages up to teenager, is the concept of a social story. So preparing your child for what's next, that can do a couple things. That can eliminate anxiety, and then it can also help them identify, with your guidance, some tools for some difficult situations. So to try to get behind that meltdown before it happens, because I'm sure if the meltdown at your house is anything like a meltdown at my house, once you get there, it's like, what do we do? This is so hard. And it's hard to bring your child out of that. And so trying to prepare them ahead of time. Hey, Johnny, let's sit down and talk about what tomorrow might look like. Tomorrow, school's going to be different. We're going to do this. And so we're going to have breakfast first. And during breakfast, we're going to talk a little bit more about it. But the first part of your day is that you're going to go to the bus. That's new. You've never ridden a bus before. What happens if you're scared on the bus? What happens if there's there's nobody to sit by? What could you choose? You could choose to sit by a stranger and introduce yourself. What I imagine right now is most buses are socially distanced, and so everyone's sitting by themselves, right? And so maybe it's, hey, Johnny, this time I know you're so excited to ride the bus again because before you got to sit next to your best friend, Larry, but this time everyone has to sit separate. So when you walk on, I want you to be prepared to sit by yourself. You're going to have your mask on. And can I take it from there, walking through some of these social stories? I think the big keys for social stories right now for our kids is we want to give them the general scaffolding of what's going to happen. But if you're too specific and things don't happen exactly as you said, that might cause more angst. Same thing with schedules. If your child is going to do better with the support of a schedule for their new routine, I wouldn't put a time on it, but I'd put order of operation. Because if the time is at 7:30, you're going to have breakfast, but you had a rough morning, or you got a phone call, or your child got up late and breakfast isn't happening until 15 minutes later, some kids are really going to hang on to that and become more anxious. And so having that flexible routine or schedule, and then a flexible social story, and that is a great tool that many of our youth at any age, as well as our youth with special health needs, can benefit from.
This is Dr. Flake. I think that goes right along with the visualization that is the part of what we've talked about with the who me. I think there's a lot more to unpack with what was presented, but if you just highlight and validate their feelings and be able to, also, like you acknowledged with them that it was hard for you too, and that they're able to externalize those feelings instead of keeping them in. I think that's the number one. Is sometimes we look at these meltdowns as a bad thing, but are they really? Because it would be even worse if they were keeping it all inside.
Thank you.
The
Thank you,
professional
Dr. Flake.
So validating emotions, and it's going to depend on the age of the child, right? And if they're teens, just saying something like, let's sit here for 5 minutes and be sad about this, and then let's regroup. I'll hug you, and we can talk through specific things and come up with a plan. And our plan might just be, we just have to accept it, but talking through it is going to be the major thing. And even if they're teens, hugging them and holding them when they're upset won't get you wrong.
Thank you. I see we have another hand up by Colonel Sony Munson. I'm going to unmute you so you can ask your question.
So yeah, I actually kind of have two. So I have a special needs kid in the house, and with online learning, he typically in his school day, he actually has like a para that helps him. But with the way that the online learning works, like it's so structured that he's unable to take those breaks that we've trained him to do while in like the actual regular classroom environment. So how do we go about it, about trying to get those breaks in there without having him like miss half of his schedule? Because like my husband's really struggling with that when he starts to needing a break and recognizing that, because my husband's obviously not the trained para.
Great question. I'm going to hand that off to Captains or Dr. Scott to start us off.
Yeah, it's so hard, especially with virtual schooling, because it's not tailored to the individual student a lot of times. And so I don't know if there'd be any way to talk to the teacher or the educator and ask for ways to accommodate and add some space in the day. But if there's ways before school to, get those breaks, and then after, and kind of work towards those. I think too, if to be honest, if without the breaks, your child's struggling to pay attention, the rest of the time, maybe a break and missing some of the school would be optimal for your child, right? I think it's hard to, give a blanket statement and your child better than anyone else. And so if a 5-minute break where he or she misses a little bit of material and then they jump right back in order to continue to pay attention, might be the best thing for your child. If they do have an IEP or a 504 plan, that'd be something that you could use to talk to the school about and say, this is the accommodations we had before. How can we incorporate those accommodations during virtual schooling, and use that a little bit as some leverage to try to get some different help from the school.
Okay, that makes sense. We've tried some of those things. I think it's just hard for them to figure out a way to implement it because everything is so virtual. And I guess my second question I have, and then I'll be quiet. So like my spouse specifically, because he has a special needs kids, I'm sure a lot of spouses are having this problem too, is the behavioral health system. He's not to the point where he needs like immediate assistance, right? But he needs those tweaks, and they're getting referred off base. I even have a little teenage girl that I help in related to like our little pod. We actually have a pod. They're not getting, how do we get them? The referrals are taking so long and they still need that help. How do we help them in that situation where my husband's like, I kind of need to talk to somebody, but I'm not to the point of, I need somebody now. Same thing with a little girl. It's like, hey, we're trying to get you some help, but the system's so overclogged right now because of what's going on.
So I'm not going to sugarcoat it. Right now, behavioral health resources are completely saturated almost everywhere you look. And that is an absolute crisis for our children of all ages. Some things that we can kind of try to get to are, your primary care provider. All primary care providers should be able to do some level of baseline behavioral health care for children. Good. And then most of the clinics on base are armed with an embedded behavioral health provider. So a behavioral health clinician embedded within the clinic whose job is to not do long-term therapy, but to do kind of short-term intervention. And so for the scenario you gave, hey, my kid needs something, but they're not at the breaking point yet, I would say jump in and be proactive and ask for that support, because it might just be a matter of 2 or 3 sessions with, you as parents and with your child to problem solve, find some good coping mechanisms, identify some triggers that lead to some tough behaviors. And all of the primary care clinics on JBLM should be armed with an embedded behavioral health provider. So you do have your PCM, you have the embedded behavioral health providers. Other options that are out there, so Military OneSource is available to help connect with some virtual sort of behavioral health. And then, as you mentioned and alluded to, so behavioral health on post is more often than not referring off, right? So I can't speak on behalf of CAFBIZ. I don't work for CAFBIZ, but we work with CAFBIZ, and we know they are pretty saturated. And so a lot of referrals are going off post. And our community off post can't support the need either. And that's true for most communities in the United States right now. Some other resources you can consider. So JBLM has something called the FOCUS program, Families Overcoming Under Stress. The FOCUS program is not a medical behavioral health program in the sense that there's no medical records, but what they are is they're a resiliency building program for families, specifically for military. They're highly trained, master's level folks who can sit down with your family and talk about how to keep your family strong during stressful times. And they're fully active right now. I believe they're doing most everything virtually, but that has been in flux. But the FOCUS program would also be another, really nice resource for your family as you've described, but also for any of our other military families. I believe it's about an 8-week program, or they see you 8 times, and they start with what are the stressors that you guys are going through as a family, and how can we break down the barriers to those stressors and help calm things down. And so it's not targeted individual therapy for your child, but it's a great way for your family to build those skills up. And so those are a couple of the resources that I would identify. You can also see through your school and your school district. Most schools, if it's on base, they have the school behavioral health. The off-base districts should all have a school counselor or school psychologist. Most of them are probably also quite busy, but that's another resource, especially if a lot of the concern for your young child is in relation to their response to the educational environment. Dr. Burr, I know you see so much behavioral health in your clinic right now. Almost all your patients at this point are presenting with some sort of behavioral health concern. And so any additional kind of tools we can offer right now?
So I do want to give a little thoughts on that, and thank you, Dr. Jordan, for taking that question. I did have to step away from the camera because this issue right here is what's keeping me personally at the near breaking point always. It is a known issue that the Pacific Northwest is understaffed with men, and we are doing the best we can. So how do you find what you need? I think the thing that Dr. Jordan pointed out about the embedded behavioral health, all of the people that are soldiers probably have experience with physical therapy, right? Physical therapy doesn't do the work for you to help make your muscles and joints strong after an injury, but they train you how to make yourself strong. The embedded behavioral health in your regular clinic where you go for healthcare does that. And they do that with a few visits where they do things like running through the type of mnemonics that Dr. Flake went through, but in a more tailored way to your individual situation. Your individual clinicians, whether it's a family medicine physician, a nurse practitioner, a pediatrician, or a specialized doc of some sort, may have differing levels of ability to do some cognitive behavioral therapy with you as an individual in a visit, as well as training you to do those types of things on their own. Trying to find a therapist, you can go to TRICARE online, Military One Source. You can turn on Google Maps and Google therapists who take TRICARE near me. All therapists are booked out pretty far, except for the embedded behavioral health that's scheduled in a way that they can see somebody within a month for acute short-term visits. If you need it, reach out for the help, even though it may be a struggle to get it. But we can do sort of layperson therapy, like buddy aid, right? Your husband's struggling, sit down and talk with him and commiserate about it. See if you can find someone else through your command that has a spouse that's in a similar vein. As a female lieutenant colonel, I know that it is a very different subject to have a home-based or a civilian male spouse. All of our resources are pretty much gender normed at a female spouse taking care of the family. And we could probably do better as a community connecting those gentlemen together. Maybe you're the linchpin for that, ma'am. I don't know. But really just, in your pod, having the parents meet with each other some as well to share the difficulties, because oftentimes just venting about it doesn't seem like it's doing anything, but it's normalizing this very abnormal experience for all of us. And just like on the airplane, when they tell you to put on your own little oxygen mask if they come out before you put it on your buddy, you can't help your child if you're really in the weeds and struggling a lot. And it's going to be up and down for everybody as long as these changes in life are. So lean on your friends, help him lean on his friends, and reach out to your clinic. You can, I believe, book for the embedded behavioral health without a visit to your primary care first. I would at least send a message either through the medical record portal system or call and leave a message asking if you can do that. It may vary by clinic. We all work out of the same base clinic, so our procedures and policies are pretty similar, but Winder Clinic is quite different than the way we do it at the hospital at Madigan. Hopefully those things are helpful.
Thank you.
Thank you. And I see another hand raised by Colonel Mears. I'm going to go ahead and unmute you so that you can ask your question.
Hi, good afternoon. Can you hear me? Hi. Okay. So real quick, and I'll hopefully be able to keep my personal opinions out of this, but is there somebody at whatever level kind of tracking all of these cases or the amount of effects that's going on based on some of the decisions that have been made at the local, state, and even national government level, so that if, God forbid, something like this happens again, and they have to make some sort of decisions on affecting schools, this other stuff, that this is going into the thought decision process. I mean, as military, we're constantly assessing risks. So are these numbers at some sort of level being kind of aggregated so that if ever this comes up where a decision has to be made like this, somebody can stand on the desk, say, if you do this, this is what you're going to see, and go forward from there? Because it just, I think there's several variables that kind of came into play with a lot of these decisions, but I don't think that it seems like the health of our children were necessarily considered as highly as it should have. When I mean, to me, it seemed like kind of obvious, but was not. And I'm making a little bit of an assumption there, but just mainly is this kind of being tracked, and how are they going to look for it to affect it for future cases if this ever happens again?
That's a great question, and I appreciate kind of the discussion on that. So I think there's a couple challenges right now, and one is, yes, we've been at this for 9-ish, maybe longer months, but it's still so early. The way that from the medical side, when we talk about aggregating data or identifying trends, especially if we think about maybe the trends for mental health, so to speak, it's still too early to really put out any good statistically significant medical data on that. And so the hope would be that a lot of this should be tracked kind of in several different lanes. So the education department and Department of Health should be tracking some of this. I know here at Madigan, we are paying attention to this, trying to look at numbers. I know different groups are doing different medical research, but again, from a medical research standpoint, when we talk about looking at numbers, we have to have a longer time period really to put out data. I do think over the course of the next few years, this is going to be a hot topic and a topic of discussion, which hopefully will help inform us for future pandemics. But I think right now our biggest tool that we have is to speak up as professionals, parents, educators, leaders, and say, this is what I'm seeing. because sure, in the beginning, decisions for lots of things were made very quickly with the idea of we want to stop transmission of this deadly virus, and we want to make sure that we ensure, safety and well-being as it relates to COVID-19 specifically. And as we've gone further into this, people, families, parents, doctors, educators, leaders, therapists, you name it, are identifying and recognizing subjectively different trends. And so part of why we wanted to do this presentation today was to share with you guys, here's what we see, and here's some tips, but to start those conversations and generate them so that the Army, the military, can do what it does best, right, and look at lessons learned and after action reviews. And was it a wise decision to close the youth center and shut down services for our tweens and teens? I'm sure there's lots of varying opinions on that, but can we look at that and down the road and say, is there something different that we can do next time, or is that the right decision next time to meet the needs of all of the children here specifically?
Colonel Mears, one thing that we do have now that we did have a couple of years ago was something called the Military Student Identifier, and we'll be able to now recognize in school data those individuals that have elected to recognize themselves as military connected. Historically, we did not have even that opportunity to look at the data going forward. So it's something that's been collected for the last couple of years, and I look forward to that helping to answer some of those questions as we compare to not only the impact on our own, but how they've been impacted due to some of the unique stressors, as Dr. Jordan highlighted early on, for being connected to the military. Over.
Thank you. So I see that we're a bit over. I don't want to keep our participants away from some of the other sessions that you guys were wanting to attend. But as panel members can remain on another few minutes if there are other burning questions out there.
Do the hands stay, or are they up again?
Miss Brunson, are you wanting to ask another question? It's hard to tell if the hands stayed or go back up. All right.
Looks like no.
Yes. So it looks like there's no additional questions. So thank you everybody who joined us today. Special thank you to my co-presenters. I appreciate you all being here with me. And I hope that you all got something out of this. We'll make sure to get those resources to the leaders of the symposium so they can get those out to you. And I'm going to go ahead and shut down the session now.